Just like people, animals react to being handled in different ways. It's only natural that animals are very nervous when they're at the vet because it's a huge adjustment. Not only do they have to leave their home, which is typically seen as their place of comfort, but they also have to undergo treatments that they may see as threatening. For this video, I'm going to discuss how veterinarians deal with reactive and scared dogs and things that you can do to make your veterinarian's experience handling your animal easier if your animal does struggle with these issues. Now, I do want to stress that the information that I'm presenting in this video is not universal. It does not apply to every species, as I am only talking about dogs in this video. Also, please do not try these strategies unless you're advised to by a professional. Again, I am not a professional, and all of the information that I am providing for this video is based on my internship. However, I will tell you that the strategies that I'm sharing in this video are for a domesticated animal that's feeling reactive or afraid, not for an animal that's posing an active threat to you. Additionally, keep in mind that whenever I say vets in this video, I am really talking about both vets and veterinary technicians. Veterinary technicians play a huge role whenever it comes to veterinary procedures, and I'm just saying vets in order to use a more concise term. When looking at a reactive animal, one of the first things that vets are usually going to think about is size. Now, size has to do with two different things. This is the physical size of the animal as well as the size of their fear or reactivity. You're going to handle a very large, very reactive lab differently than you are a Chihuahua that only has very minor aggression issues. A good owner is going to tell the vets if their animal struggles with either fear or reactivity, so hopefully the vets can kind of be prepared and make an assessment before they start treating the animal. The next thing to think about is what is triggering this animal. Is it the amount of people in the room? Is it the characteristics of some of the people in the room? Is it being touched? Sometimes vets can adjust what they're doing in order to suit an animal's needs. An example of this is clearing some people out of the room or trying to make less contact with the animal when possible. Reaction and responding to the context of the situation is also very important. Sometimes, if an animal doesn't like being around a lot of people, you can cut down on the amount of people in the room. But if an animal doesn't like being around any people, then you probably don't want to cut down on the amount of people in the room, because if the animal lashes out, you want to be able to get him the support he needs. Precautions such as muzzles can be used in order to help animals that experience reactivity, but unfortunately, if they're still fighting back and posing an active danger to the staff, then unfortunately they may have to be held down. Luckily, vets are trained in order to make this experience as comfortable as possible. There are also a multitude of ways that vets can comfort animals while they're holding them down. So I'm going to demonstrate a little example of this. So a common thing that we're going to use is distraction techniques, which is something like patting really aggressively on the head. Not to the point where the animal is feeling pain, but to the point where they are distracted from whatever procedure is being performed on them.